Hello, everyone. Welcome to the Wellness Project this Thursday, April 27th, 2023. We are broadcasting from the beautiful North Bay, Ontario in Canada. My name is May Clark. I'm owner and operator of Earthlight Energies Incorporated. I'm a certified and registered energy healer and Reiki practitioner and teacher. This evening, I have the pleasure of having Cori Toshack on the program. Cori is owner and operator of Prep Therapy. And before I bring her on, I'm just going to show you Cori's information here. The name of her business is Prep Therapy. She's an athletic therapist and injury management and does injury management as well. So I'm just going to stop this screen and we're going to pause and wait for Cori to. Okay, so welcome, Cori, to the Wellness Project. Thank you very much for agreeing to come on and talk about yourself and your business. And I apologize because I said your last name incorrectly in the introduction. So I'm just wondering if you could give us your full name and the proper pronunciation.
Yeah, so my name is Cori Toshack.
Toshack. Yes. Okay. That sounds way better.
It's okay. It's okay.
To do. So,
like I said, I've been called it. Yeah, I've been called it different my entire life, so I'm used to it. So it's okay.
That's okay. People have issues with my name too, so I get it. And that's why I always want to make sure I'm pronouncing people's names properly. So, welcome to the program, and it's pretty informal and casual. So if you just feel like talking about different some different topics, feel free. Okay, so I guess the first thing to start with is telling us a little bit about yourself, so you can share as little or as much as you would like.
Absolutely. And I will just say I do have my dog here as well. He just kind of lays around, but you might hear him grumble every now and then. So
that's okay. What kind of dog do you have?
He's a Border Collie Australian Shepherd. I'll put this down a bit.
Aww.
Yeah, he's a 10-year-old boy that comes to work with me every now and then. So
well, that's fine. I've had people bring their dogs with them, so they love it.
Yeah. Oh yeah. So my name is Cori Toshack. I'm the owner of Prep Therapy. So Prep Therapy is an athletic therapy based clinic. So I'm an athletic therapist. So my kind of background of where I started was I'm born and raised North Bay. I went to Nipissing University for a phys ed degree. And in my fourth year, I had no idea what I wanted to do with it. I just knew I didn't want to be a teacher. So I didn't want to go to teachers college, which 90% of the class was going there anyways. So I always wanted to do something a little different. And one of my mentors, which is Heather Benison, she's a rec therapist, and she was a placement host for me in my fourth year. And it changed my life meeting her because she recommended athletic therapy to me. And I had no idea what it was, never heard of it. So we kind of looked into some schools and what direction I could take with it. And so we found that at Mount Royal University in Calgary, you can do the program for 2 years if you have a bachelor degree already. Wow. So instead of doing a full 4-year program, because you need a bachelor degree in it in order to write the certification exam. But you could do it in 2 years because it basically condenses some of the courses you've already taken. And so I packed everything up. I packed Coda up, and he came out with me for 2 years in Calgary. And then I wrote the certification exam, and I moved right back to North Bay.
Wow. Glad you came back. That's for sure.
Yeah. I'm super glad. It was Calgary is very saturated with athletic therapists because it's a growth place for athletic therapists, and that's actually where the national board is in Calgary as well. And so I thought, why not North Bay? North Bay, like I've always wanted to come back and just help my community and help my family with any kind of aches and pains or anything they go through, and having that knowledge and just being there for them, but then expanding it to the community and helping everyone out.
So what led you to take the course that you did at the degree that you did at Nipissing? What is your background there?
So I've always been like through high school and club and whatnot. I was an athlete, and I did a bunch of different sports, and I always loved sports. That doesn't necessarily mean that athletic therapy is just a sport realm, but we'll dive into that a bit more. But I always was fascinated with the injuries that occurred in sports, and I have no idea. I don't know why. I remember being, I think maybe grade 10, and a young guy had fallen on the court, and he ended up breaking his leg. And I was just so tuned into like, how is he being cared for? What's going on with his body? How are they stabilizing it? Right. And so kind of since then, it's always brought me back to, I have such an interest in injury and how the body works and how can we care for these people and get them back. And so when I was talking with Heather about my passions and what I like to do, she's like, oh, easy, athletic therapy.
Wow.
So yeah, that's kind of what got me into it and really interested in it. And every single course I took with the Mount Royal program was interesting. I absolutely loved every course.
So is athletic therapy, is that a newer therapy, or has it been around for a while? Like, what's the background with that? And
So
I understand, I can, with sports being huge, then I would think that that type of injury becomes a much needed specialty. So
absolutely. So it has been around, and I'm going to butcher the time frame, but somewhere around, honestly, 50 years it's been around.
yeah. Okay.
Yes. So and it's, the term has changed a little bit. So athletic trainer is what's used in the States. So you'll see a lot of that, and the role kind of gets blended a little bit with especially kind of in the hockey world or the major sports with equipment manager. They also used to sometimes do the medical side of it, right? So those roles kind of got blended, and now they're being very distinctive. An equipment manager is an equipment manager. An athletic therapist cares for the injuries that's happening on the sport or on the court or whatever it is, but also the aftercare as well. And then that has dove into more of what I do today is clinic stuff for the general public, because an injury is an injury. It doesn't matter if you get hurt on the court. It doesn't matter if you get hurt in your driveway. You got to get that ankle back, right? Whatever it may be, if you sprained an ankle or whatnot. So for me, it doesn't matter what I'm getting you back to, whatever your passion is or whatever you need to get back to. It's all the same structures, right? So the rehab is just individualized to what you need to get back to.
Right.
Yeah.
So how did you come up with the name for your business, Prep Therapy?
So I sat on a few names for a little while because my name is Cori, and kind of the core is the main piece of our bodies, and that's where a lot of our stabilization comes from. So I wanted to name my business Core something for a long time, but with Core Maximus here, I didn't want to confuse the two. And so it took me probably a few months to come up with Prep Therapy, and I was sitting with my mom, and I love names that have acronyms, so it's a meaning to something. And so PrEP therapy stands for prevention, rehabilitation, education, and performance. And those four aspects are everything that I do in every single appointment. So there's a prevention piece, there's the rehab piece, there's always an educational piece on how to care for yourself when you leave this room. And then there's the performance piece. And whether that's, like I said, a sport, whether you're returning to a court, a field, the ice, you're returning to work, you're returning to a labor job, you're returning to your kids, right? You want to kind of play with the kids, it's grandkids. So the performance isn't just athletic based, it's performance of life.
Right. Yeah, and that's kind of actually how we ended up meeting. Well, we actually had met before, which we found out when we actually connected again this time. But so you've kind of given an overview of some of the people, like it's not just an athletic injury. Could you talk a little bit more about what service, like if I came in to see you, what would that look like? What are the services that you provide?
Absolutely. So there's a couple different services that I provide. So the main one it's an assessment of a musculoskeletal injury. So your bones, your joints, tendons, ligaments, muscles. So an injury to those and nerves as well. But a lot of people, it's not very specific to one structure. If it's a ligament sprain, they might have joint dysfunction as well, right? So it's not just specifically you have something specific going on. But so when you come in, an assessment is a head to toe assessment with me, trying to figure out how the body is working with itself. So what joints are working together and what is the cause of the injury? Whether it's an acute injury, so you rolled your ankle, or it's a chronic injury, you've been dealing with this for a while, there's really no cause for it, it's just come about. And so those are a little bit more of the head to toe. Okay, what is this puzzle that we need to figure out that's causing this pain for you? So something that's very common that I see is desk workers and posture, right? So
yes.
they might have upper body pain, or they might be getting headaches from their neck, and they don't know why, but it's postural, right? So that's just a brief example, but
or
so
even for the office, or not just office, but for other people as well, it could be repetitive motion injuries.
absolutely. So many repetitive strain injuries are very common, and people are starting to understand more of those now. Whether it's line workers who do repetitive tasks over and over again, whether it's kind of the industrial world of it's a jackhammer all day long, whatever it may be, repetitive strain injuries have a really big effect on your physical health. And you might not notice it for years after doing this repetitive motion, right? So that's the prevention piece of what I do as well, is trying to prevent these injuries before they happen, or preventing the intensity of the injury. So that's my main service. So you'll come in for an assessment, we'll figure out what's going on head to toe. And then after that, we'll go into a follow-up appointment, and that will be more of the manual, the hands-on, trying to reduce the symptoms, whether it's pain, whether it's numbness, or maybe it's a lack of mobility. So a lot of what I do is pain management and mobility. So trying to get those two back really helps people get back to 90%, right? After that, it might involve a bit of strengthening or a bit of coaching and that education on, okay, how can we prevent this from happening again, right? So I don't like people coming in week on for months on end. I want you out the door as quick as possible, and I want you to take the education with you. So I don't like to give 6, 7, 8 exercises. It's not realistic. No one's going to do that, right? So I like to give maybe 2 or 3 exercises that are going to stick with you, very simplistic to do, and you can kind of just mold them into your daily activities. So I find the body reacts better if it starts to become routine. Something as simple as shoulders back.
Yeah.
Right. Something as simple as that. And that's an exercise, helps with the nerve pain. So so that's one service. The other service is more of the sport world, where I do field work and I'll work with teams. So I work with Canada during their seasons of volleyball and basketball. And so I'll be on the sideline more as a first responder. So if an injury does occur, I'm taking care of that, deciding whether they can return to the game or not. And then after that, how am I getting them back to the game, right? Or not that game specifically, but how am I getting them back on the court? So that's the field side of things. And then the last bit is knee bracing. So I do custom knee braces for ACL, PCL, osteoarthritis. So actually, I'll show you one that I've got, because some people might recognize it.
I'm gonna have glasses on to do that though.
Yeah. So this is a classic DonJoy brace. So you may have seen.
Oh, look at that. Yeah.
Yeah, so this is a custom one that they've graciously lent me as a demonstration, but we make these custom. So you come in, I do the measurements for you based on, usually if it's an arthritis or an arthritic knee, you've seen your doctor already. So you know which side the arthritis is on, which side you need to offload. And then it's just a quick format with some measurements that I'll do. It takes about half an hour to do. A little bit of education for you as well. You send it off, 2-3 days, you've got this, and we try it on. And then, so
it's
very
amazing what they can do now.
It is crazy.
It looks really lightweight. It doesn't look like, I've seen those knee braces that are all metal.
Yeah.
How could that even be comfortable?
Yeah, this is the standard Defiance brace. They do have another one called an A22, and it's made of titanium, so it's even lighter than what this is. Wow. I usually recommend it for high sports or high impact. So if you are a labor worker and you need something lighter and you're walking around all day, this might be a little too bulky for you. But those are, yeah, that's the services that I offer.
And you have a few tools that you use and some other different things in your when you're doing your therapies, right? I think is it cupping you use, and there's some other special blades in that you use?
I'll grab those as well.
Sure.
So I do cupping therapy, and I use the silicone cups. There's a couple.
So for people who don't know what cupping is, could you just explain a little bit about what that is?
Absolutely. So it's kind of, it's a vacuum effect through the silicone cup. So you put it on the skin here, and so it's got a bit of a vacuum effect. So the tissues are coming up into the cup here. So it's creating space. So it's helping for the tissues underneath.
Okay.
So I'll do a lot of movement stuff with it. It helps them glide. Really, really great for the nerve. When the nerve gets trapped, you just need a little extra space. On top of that, I'm bringing blood flow to the area. So if there's a tissue that needs a little bit more regeneration, the cups help bring blood flow to the area to help heal that tissue. So for ligament sprains, muscle strains, really, really good. I love doing it on the shoulder. Tons of mobility through the shoulder when you get it up in the joint here. I see lots of good results. It does sometimes leave a mark there.
Oh yeah, look at that.
Yeah, so you might get a bit of a mark. It does go away. Yeah, some people, it does cause a bit of like a bruising effect, but it's not a bruise to touch. It's just because that's where the blood flow has gone.
Right.
Yeah, and then so similarly, so the cupping, actually, I'm going to go back to that for a second. I do also another technique where I'll use like a lotion or a beeswax, put the cup on, and I'll glide. So that's breaking up some of the fascia underneath the tissue. And again, really good for mobility to kind of incorporate the movement with the movement of the cup. So then similarly, and it's not painful whatsoever. These are not painful either. I don't want you to think they are.
Those look ominous.
Yes. So there's a couple different sizes. So
wow,
this guy.
They're big.
They are. So I'll show you the comparison to my hand of this one. So I've got small hands. This is probably one of the ones I use the most. And it's got these curved, it's all curved, beveled edges on everything. Nothing's sharp. Nothing's going to cut you. But it's meant for a round joint. So this one I'll use a lot on kind of wrists to kind of get right in there, or the elbow right on that joint through there. It's breaking up fascia. So fascia is really common for having kind of adhesions to it, and we lose mobility.
So can you explain, sorry to interrupt, but could you also explain for people who might not be familiar with their own anatomy, what the fascia is, or fascia? People, it's like the stuff you put on the side of the building, right? On your fascia, which one is it?
Yeah, we're not treating fascia. So fascia is the layer between the skin and the muscle. So this is actually a new tissue that has been kind of discovered within the last 30-ish years. We didn't know that it existed until we're starting to open up more cadavers and whatnot and finding it. So what happens when we injure ourselves, or we do repetitive strain stuff, whatever it may be, typing at a desk, it starts to get these adhesions. So it kind of gets stuck. So it doesn't have that glide as good as it should, right? So you'll notice a little bit of a tension or a tightness in the muscles. So using the tools, and again, I use beeswax, so it's not just ripping the skin or anything, but I'll use beeswax on there, and you just kind of blade right through here. There's a couple different techniques I'll use, but it's just breaking up the fascia, and the beveled edges are just more specific than what my hands will do. So it helps my hands.
Your hands too, because that's a lot of, like, you talk to RMTs, and one of the things, it's very hard on their own hands, and especially their hands and their body when they're doing deep massage and that. So
absolutely. Yeah. So I will use these as a hand saver for myself, and almost like a pre-treatment to getting into deeper tissue if I need to. And so this big guy here, I only ever use it on hamstrings or quads. It's never used anywhere else because it is a bit heavier, but it's really good for kind of just going a little bit deeper into those bigger muscles. But this guy doesn't get brought out a lot. It's mostly this one that I
use. Wow. And you also have some there's balls and you have tubes and stuff that I think do you sell them or do you just use them in your practice? Some of the
So
products that you have for people to take.
yeah, so I think you're talking more of the products that I have, which are I'll utilize. I'll show you this guy as well as this one here. So these guys here, I don't know if these are kind of the tubes that you're thinking of, but this is a foot roller. So great for plantar fascia, or just you can roll out any joint if you want to stick it behind your shoulder and roll it out on the wall. It's a moldable one, so it can groove right into the joints you need to. I'll do heat rubs or ice rubs, and these guys are, they're all roll-ons, so you don't have to get it on your hands, which is really nice.
Oh, nice.
Yeah.
I think the tube that I saw was like it was almost like a big styrofoam. Oh, I see it in the back.
Okay. Yes, that white one there.
Yeah.
So that's a foam roller. So for people who have mobility issues, usually through their backs, so whether it's kind of thoracic mobility issues or extension, I'll do some stuff with the foam roller, or if it is a high intense athlete who needs a little bit more love post activity for a little bit of recovery, we'll use a bit more of the foam roller. Use resistant bands as well for strengthening. What else? There's K-tape that I do. So I'll do some K-tape mostly on shoulders or knees. And it's just so it's just this stuff here. So I use Rock Tape, same brand there. I don't know if I have any available there, but so it's a roll. So K-tape, also known as kinesiology tape, it has a different type of woven pattern to it on the sticky side. So it's stretchy. So it'll stretch and it'll pull in a little bit of a different way for the tissues. So it does the same thing as a cup. It kind of lifts the tissues slightly.
Can you use it for tummy tucking?
Honestly, people use it for postpartum after having babies. Wow. Yes. So for a little bit, whether it's a C-section, just to kind of help with some of the scarring. Yeah. The other thing that K-tape is great for is bruising. So if you tear a muscle and you've got this massive bruise going on and you need a little bit of lymphatic drainage, so because it lifts off the skin, it kind of creates these portals for all the gunk that's hanging out in that bruising to get to the lymphatic system.
Wow, that's really cool.
Yeah, you should definitely look up pictures of how K-tape helps with that, because you'll see this bruise and then there's all these striation patterns in it because that's where the K-tape was laying.
How interesting.
It is, yeah. So I absolutely love K-tape. There is a time and a place for it, but that's a part of the education that you'd get when you come in here, and I can help you out with that.
So if someone comes in to see you, you're going to do a consultation. How long does your consultation usually take?
Consultation is an hour long. It's about an hour long. And it's $85 for the hour. So like I said, it's a full history. We go through kind of what's going on, why it's happening. And I try to get some of those puzzle pieces put together to figure out so that my brain can say, okay, this is what's going on.
Right.
Then it's the head to toe. I might do a gait assessment. So watching you walk, seeing how the body works together. And then after that, you get on the table there and we'll do a little bit more with the joints specifically to figure out what's working, what's not. And then there'll be a small piece of manual therapy to kind of give you some of that pain relief and loosen some things up. And then we finish it off with a little bit of that education and maybe one or two exercises to start you off.
And then, so what happens at the next session? So if you assess the person and you feel that there's some things that you can do to help them, they come back for their next session. Do they come back the same week? Do they have to wait? Like, how does it work?
So it'll depend on the assessment and what I find. If I feel like they can wait a week, do some of the exercises and some of the techniques I've taught them, and see how that goes. See if that has helped the injury, reduced kind of the strain of what's going on. Or if it's something that's very acute and really painful, you might come back that same week.
Okay.
So that would look more like very much so hands-on within that half an hour. It's just you on that table, me hands-on, and then again at the very end, a little piece on education, as well as maybe some exercises to progress from the assessment or to change based on how the first couple days or the week went. So you won't go longer than a week without seeing me after an assessment usually.
Okay. And then your sessions are half an hour. And at the time of this recording, how much do you charge for your half-hour sessions?
Yeah, so the so assessments 85 and then treatments are 60.
Okay.
And that's tax included.
Tax included. And usually, like on the average, how many times does a person have to come back, or does it really depend on what type of injury they have?
So there's a couple factors that it depends on. So one will depend on the type of injury. So generally a ligament or a muscle strain, you're looking at 6 to 8 weeks of recovery. That doesn't necessarily mean that you're coming to see me for 6 to 8 weeks. It might be 3-4 weeks, 3-4 appointments that we have. They might be staggered out though, right?
Right.
And so as long as you're taking that education with you, that's the other factor. So if you're going home and you're not doing anything to help yourself, you might have to see me more often.
Right.
Right.
Yes.
So there is a component of taking care of yourself as well. And that's going to really boost your recovery.
Right. Okay. And how we ended up meeting was that with my clients, of course, with I shouldn't say of course, but with Reiki, we work on all the levels. We work on physical, mental, emotional, spiritual. And I mean, we don't control what it does. People come in, they present with whatever it is that they're working on. We're peeling away those layers. And oftentimes, well, there's a couple of different components of it. And one is, they come in with injuries that happen in this lifetime. Oftentimes, the people I see are people who've had injuries that they've had for an extremely long time. And they've tried everything. And, now they're here for the Reiki. So there's energetic parts of that. And I'm sure people who are doing the type of work that you're doing, whether you realize it or not, you're releasing energetics as you're doing that manipulation as well. It's not just the physical components in there that you're working on. There's actually energy that's released in there too. And that trauma from that injury can actually be stored and right down to the cellular levels. So, and I have had clients where the Reiki has it's been miraculous what's happened, to these old injuries. They've actually been able to heal almost completely from them, and now it's just more manageable. But again, these people were also, really invested in changing and having a different way of life so that they could not only get rid of these injuries, but just feel better all, together. However, then there's the people and as we go through this work, oftentimes get down to the end and it's like, well, they still have this pain. Nothing is relieving this pain. And it's like, well, then where do you go? Because they have already been to the RMTs. And I do have a question about some of these other modalities. You may or may not be able to answer it. They've been to all these other different, trying different things. And then it's like, well, where do you go? There's got to be a way to get rid of this pain and this injury. And we kind of talked about it. It's like, what happens then with that pain is it becomes so part of the person that even if I don't know how to explain it, but it's like, even though there may be some relief, the body and the mind still thinks it's there because it's been such a part of their, their whole physical and energetic body that sometimes it's a mental thing that is hanging on to it, or an emotional thing. So if we get through that on the Reiki side and then they still have this pain, it was like, okay, well, where are these people going to go? And then I ended up having a client who had gone to see you because the same thing, we had worked on all these other things. And I said, well, you still have this pain. We've gotten rid of all of the other issues on the energetic side. You have to find somebody who's going to be able to relieve that pain. And within 3-4 sessions, unbelievable. And this person had repeated old injuries. Oh, sorry. And you know, and then I sent another client who had had some nerve damage, referred a client who had nerve damage, and you know, you were pretty honest with them and said, not sure what we can do to help, but we're going to try. And for the first time in many years, this person actually had relief while you were actually doing the work for them. So for me, and you know, she had been to her physician, and the physician said, well, there's really nothing we can do for you because of this damage, which was from an accident. And so here's some pills to take. And she didn't want to take those pills.
No.
Because of all the side effects, but also it wasn't relieving the pain. So, you know, and now as I see my clients who present with these same things, or similar issues where they've had long chronic pain, it's great to know that there's another place for them to try, that, you know, there's some different things and they might actually get some relief from this pain. So I see it as just a great, because Reiki works with other modalities, and it should be right. Well, I shouldn't say it should be recognized, but a lot of people don't recognize that is, you know, there is an integration with other therapies and it works really well together. So, but I have a question. I don't know if you'd be able to answer or not, but when it comes to I can never pronounce these.
Osteopathy.
Yeah. And physiotherapy and chiropractors, like, what is the difference between that type of therapy and what you do?
Yeah. So, like I said, there's always a time and place for different practitioners, for different modalities, as well as different therapies. And my philosophy is always whatever helps you. If seeing a chiropractor is what gives you the most relief, keep seeing the chiropractor, right? No matter what someone tells you. If they tell you that, no, you shouldn't see a chiropractor because they just do joints. If it's helping, it's helping. But when you get down to the difference between us, so athletic therapy, and this is a personal bias here, is almost a bit of a blend of all of them, but a very concentrated thought process on what specifically is happening. It's not a routine. When someone comes in with an ankle injury, again, we'll use that as an example, it's not the same thing every single time, right? So this is an individual who has this experience going on and their body is healing in a certain way. It's not always the same. And I do find that in our kind of Western medicine, we've gotten used to this like assembly line of like, okay, this is your injury, do this, do that, do that. And so we lose that care for who the individual is, and we lose the care for what specifically do they need.
Right.
And so, and maybe that's not specifically athletic therapy. Maybe that's just my philosophy. But athletic therapy is a blend of massage therapy because it's manual based. There's a lot of massage techniques that happen, but it is a blend of chiropractor in a sense. We do not manipulate joints. We cannot go past the physiological barrier of a joint, but we do what's called mobilizations. So we mobilize joints in a very gentle and active way under complete consent of the client and completely in their control. If there's ever an issue and they're not comfortable, it stops. That's it. Right. And generally it's pain-free. And then the other piece, physiotherapists are probably the most related to us because our backgrounds are very, very similar. So we do rehab, we do assessments, we do exercise prescription, almost identical. The only thing that physiotherapists have, which is why we have this kind of difference between us, is they do cardiac rehab. So heart attacks or any kind of cardiovascular disease and stroke victims. So neurological disorders. So whether it's a stroke, whether there's something going on with the brain, whatever it may be, right? So they'll deal with those major things, which I don't touch. The only thing with the brain that I do touch is concussions. And so
Oh,
because
so maybe you could speak a little bit about that, because I often have people coming in here from children right up to, older adults that have had concussions. So I'd be very interested to hear what you have to say about that.
concussions are this, it's like this hot topic right now, and you do see it a lot in the sport world, because athletes are coming forward saying that they've had so many concussions and now their lives are affected. Concussions are very interesting because sometimes it happens at an early age and we don't get symptoms till later on. So that post-concussion syndrome really kicks in. And it's really, really hard for people to do daily activities. And that's probably a lot of what you see, are these kind of symptoms people get. They may be irregular, it may be regular. There's no again, set structure of a concussion. Everyone has a different experience with it. So what I do as an athletic therapist, and this is also something that I took courses in outside of the athletic therapy, but a lot of it is opening up through the joints, through the head and neck and shoulders. So a lot of that tension sits within here. When we're stressed, we do this, right? We're trying to protect our neck and our head. A lot of what I do is kind of through the occipital area, as well as kind of temporal there, and just really releasing all of that tension. That's what I do with my hands. On the other side of that, we'll do vestibular ocular motor techniques. So we're really working with the eyes a lot. So working with kind of tracking, because that's usually one of the things that gets affected the most or causes symptoms the most, is trying to be in a space where you're getting all this sensory input and your brain can't handle it, because our brain has a capacity. And when we have a concussion, that capacity comes back down. So we're being kind of pushed down a bit. So when we're doing regular daily activities that come up to here, we get those symptoms, right?
Right. And I know quite a few people have had, even family members who've had very serious concussions and can't read anymore.
Absolutely.
Or at least or sometimes it's been like a whole year before they could actually read.
Absolutely. So a lot of what I do is trying to teach people that capacity thing. So when you have a concussion, your capacity might only be here. It doesn't mean we can't grow it. That's part of the rehab, is growing it, as well as the vestibular ocular motor control. But we have to know how to live within it until we can grow it, right? So part of that will be seeing you creating a lot of that energy release, so that we can get that capacity and we can go to the grocery store, and the sounds of people there, or the music even, isn't irritating us, right? So it's something as simple as too much sensory input that just puts us up to that capacity. So I do a lot of work with that for concussion. So a lot of post-concussion stuff.
Well, I'm glad that you brought that up, because that's good to know. And it just seems I mean, we just know so many people who've knocked their heads, and I wasn't even aware until one of my family members had a concussion that there were different levels of concussion. So that was interesting as well. And then one of the other things that we had talked about is, people that come in with injuries or trauma. It doesn't have to be injury, it can be trauma, and may not be within your belief system, but I mean, I know this is what I work with. So oftentimes they will come in and they all of a sudden have something flare up that has perfectly healthy, there was no accident, there was nothing around it. Now all of a sudden they have a pain in their back. Where did that come from? And, or they go to the doctor and say, I'm experiencing this, and they do all the tests, they can't find anything wrong with them. That, obviously there's something, but they can't, with all their tests and equipment and stuff, pick anything up. And so when they've come in to see me, then I can actually feel the past life energy, and then I'll know that this is something that is caused by a past life. And then I do get some information around that, but I usually then consult with a colleague of mine, Janet Graham, who's she calls herself a spiritual consultant because she doesn't like to be called a psychic. And I'll say, this is what I'm picking up. I feel like it's past life. And then she'll either say yes or no, and she'll give me details, which is always such a relief to the client, because then it's like, even if they never heard of past lives or kind of believe it, they find it fascinating and interesting. So the very first time I had asked her about this, for this one young client I had, she had been seeing a chiropractor for like 4 years and had a pain in her shoulder that she just couldn't get rid of. I went, wow, like if it's not shifting or moving after 4 years, there's definitely something else going on. And right away, like I picked up that past life energy, talked to Janet, and she said, oh yeah. And she explained what had happened. And she said, you should be able to energetically be able to remove most of it. So my question then to Janet was, well, okay. And I was just learning more about these past life traumas and injuries. This was quite a few years ago. And I said, okay, well, why wasn't that person born with it then? So if it came from a past life, I didn't know how it worked. Like, well, why didn't they come in with it? Why at this particular time and this age? And she said, because that was the age that trauma had happened in a previous life. So it's really interesting that happens to us as human beings. And then the energetic work that I do with Reiki will help to relieve that. Now, there have been times when after all of that is done, there's still something else there, and it still needs some kind of other physical modality, let's call it, that can help with that. So yeah,
it happens more often than you would think, where people come in and they go, I've seen so and so, I've done these tests, I've talked to my doctor, my physio, my chiro, whoever it may be, and they all kind of write it off as something, but it doesn't get better, right? So they're given almost kind of like Band-Aid techniques to help it and kind of suppress the pain in a sense. And those are my favorite clients. Those are the puzzles that I love. The ones who are like, I've been to everyone and no one can figure it out. Last ditch effort. We'll see what athletic therapy can do for me. And it's honestly, it's caring for the person as an individual. Because if you are feeling pain, you're feeling pain, right? That you're not crazy.
No,
there's not made up in your head. There's something going on that's causing this specific pain wherever it is on your body. So let's try to figure out what it is and let's work together on it. And I love that we get to collaborate on that now, because now we have the physical side as well as the whole mental and the physical and the emotional side with you, right? Releasing that energy from the past life. And it's
not even just the past life, because any injury creates trauma, right? So
absolutely, yep.
Yeah, and I mean, as these practitioners work on people physically, they are releasing. They might not even be aware that that's what they're doing, that they're releasing that. And then sometimes that can cause other effects that, we call it, I hate using the word healing crisis, but, when you start to release these toxins, and that's the physical part of it, but when you start to release some of the energetics, that can actually bring up some other emotional or mental. I don't know if you've had it happen where people have experienced some anxiety, or they've gone through some depression, or, there could be all these other different emotional things that are happening around them. And they don't understand, they're not connecting the dots, that it's like, oh, well, I went in and did this, well, I don't know if it's true or not. But, here's just an example. Someone had said to me, well, we hold a lot of energy in our hips, and, so emotional stuff in our hips. So when that gets released, that might actually cause someone to be emotional and it's not making them emotional, it's releasing the emotion. So the person might feel emotional for 24 or 48 hours afterwards as they go through that release process, and then they should feel really good after.
And that kind of ties into the book that I was recommending to you, is The Body Keeps Score, and it talks about how our psychological health can really manifest in physical health. So again, that kind of like, it came out of nowhere pain, and it's a physical manifestation of this stress or psychological kind of dealing that you have going on that you haven't addressed yet. And so sometimes when we take away that physical pain through manual therapy, that emotional side gets a little bit bigger. And that's sometimes that reaction of emotional release happens, or vice versa, where we get rid of the psychological piece, or we're addressing it. And really that physical piece either starts to go away because we've addressed the psychological, or it's just more prominent because we haven't addressed this manifestation, because our body does guard. We protect ourselves, right? So it's not to say the muscles aren't contracting or the joints aren't getting tighter. It's protecting your whole body.
Right. Yeah. And I see that all the time. And one of the things when you learn about Reiki or energy healing is that, you know, we have this auric field. We're an energy system. Our whole body is, but we also have this unseen field around us, unless you have the equipment to be able to take pictures of it, or you actually have the gift to be able to see it. But this auric field is actually supporting our physical body. So often what will happen is, and this is why one of the things that makes Reiki so great, is that if there's any illnesses or conditions that are happening, they often manifest themselves in this light body that surrounds us. So if we can clear those energy blocks and clear all of that out beforehand, then it won't manifest itself in the physical body. So it's understanding that there's all these components of our well-being that we have to take care of. We just have to look after ourselves and understand that, you know, even the things that we can't see or don't understand are actually affecting us. So, yeah.
Absolutely. And that's something I've really dove into recently, is understanding psychological stress and how it manifests itself in the body. And you can feel a difference in the tissue. People don't understand this, how we can kind of feel things with our hands.
I know.
But you can feel the difference when there's somewhere it's coming from physically, or it's a manifestation from something psychological. And I love to offer people a referral to someone who can help with that piece, because it's not a part of my scope of practice.
Right.
It is something that I address, is psychological rehab, but I don't have the tools to teach that and to help that.
Right.
It's more so a recognition piece from me. And so I love that people are being more open to these types of holistic health care like Reiki, and accepting that and going through with it to help their physical body. So
yeah, and I mean, it's so fascinating what you say about because, you know, it's any Reiki practitioner. I mean, it's very hard to explain to a client. I can actually feel, you know, as a practitioner, we can feel the difference in your energetic field. And we can work above your body, we can work on your body, but we can actually feel the difference in, you know, sometimes they joke around about, you know, the force, like that. There's the disturbance in the force, but that energy around, we have this life force energy that is flowing through every part of us. And if there's a disruption in that, we can actually feel it. So, and then it just becomes difficult to explain, but, you know, you can feel it because it's a density, it can have a temperature, it can have a vibration, but it's definitely there. And it always surprises people, because sometimes people don't, you know, they may forget about things. Oh, I forgot I broke my ankle when I was 6 years old. And then I'll be working on their feet and I'll go, oh, did something happen to your left ankle? And they'll go, oh yeah, I forgot I broke my ankle. How could you even tell that? Well, it has a different energy that tells me that was a broken bone at a certain time. So yeah, it's pretty interesting. It's pretty cool. We do cool work.
We nerd out on it. I love it.
Well, before we sign off here, is there anything else that you wanted to share?
The only other thing, and this is probably the most common question I get, is it covered by insurance companies?
Oh, right. Yeah.
Right. And so, yes, most major insurance companies have athletic therapy coverage. It's just whether or not your employer or your benefits package has athletic therapy under that paramedical umbrella. So it's not physiotherapy because we are different designations. It has to be athletic therapy. So sometimes it's as simple as picking up the phone, calling your insurance company and say, hey, I want to add this. Or if it's through employer benefits, talk to your HR department or whoever deals with the insurance side of it and say, hey, I see benefit in this. Let's add this on and utilize it, right? So it is covered by most major insurance companies. We're fighting for it a little bit more than.
Yeah, and we're doing the same thing. I'm a member of the Canadian Reiki Association, and so because we're able to issue the extended health benefit forms. However, I have yet to find an insurance company. Well, there have been a few, very far between though, that actually accept them. But what I tell people is just submit it anyway. It's going to get rejected, but the group benefit providers and your employer, well, they should be talking to the employers and saying, it looks like people are trying to get this covered, so is this something we can add in? I don't know the mechanics behind the background, but I just know, having worked in that world a long time ago, that they do pay attention to the ones that do get rejected. And if you think about all these other ones, that fought to get coverage, and now you can have coverage for, so hopefully someday we'll get that coverage.
I think it will. We're going into a world of holistic and alternative health medicines that are very beneficial to people, and we're seeing a lot of results compared to our Western medicine philosophies. And so I think we're going in the right direction for that. And honestly, it's advocating for it. If this type of healthcare works for you, talk about it. It's never wrong to talk about it with your insurance provider and say, hey, I want to add this. The more we talk about it, the more people go, hey, I've had 4 people talk about it this week. Maybe we should look into adding it, right?
Yeah.
So if it helps you, talk about it.
Yeah. And I I do have some of your brochures and stuff here, and I do like that you added the injury management piece on there, so people understand that it's not just, it's just not for the athletes as well. So anyways, I so appreciate you taking the time to join me and talking to me about your business and the stuff that you do, the interesting work you do. So I'm going to let you go here. And I have before you came on, I had your contact information. I'll also put it in the link below. So take care, and I look forward to seeing you again soon.
Yes, thank you so much.
Okay, take care. Bye-bye.
Bye.